With the state in phases of an economic restart, local health departments urge people to continue to follow the safety guidelines connected to the stay-at-home order. Those, of course, include social distancing, washing hands frequently, covering coughs and sneezes, and staying home when sick. In this installment of Reopening Mid-Missouri, KRCG 13's Kyrion Lee checks with county health departments on their concerns going forward.
It's been an incredibly busy time for county health departments. I spoke with local health officials to get insight on efforts so far and what to expect moving forward. It's been 2 months since Callaway County reported its first case of COVID-19.
We had a general plan. We knew what we needed to do. We knew the partners we needed to partner up with, and we worked very well, I think. It was sudden, came on quickly, but I think we did really good with it.
Just a little more than 2 weeks after reporting its first case, the county sadly lost one person to the virus.
It was unfortunate that we lost anyone because of this, and we don't want to see that again.
At first, the positive cases were on an upward trend, but Kent Wood with the Callaway County Health Department says that has changed. The county hasn't had a positive case since May 1st, and while numbers are leveling out, Wood says COVID-19 still remains a concern.
A lot of people may be asymptomatic, and that's what was found in a lot of these meatpacking plants, that there were so many people that were asymptomatic. They tested positive, but they had no signs.
And although restrictions on day-to-day life are lifting,
if you don't feel good, or if you come up to a business that looks like it's very busy, that there could be a lot of folks right there, bypass it till later. Come at a different time. Distance yourself out. You know, this is going to be the important thing to do for a period of time.
In Cole County, Communicable Disease Coordinator Chesney Schulte says since before the first positive case, communication between city and county leaders has been crucial.
I definitely think that we were prepared, and luckily we had a lot of research and data going into it as we watched it spread from internationally, more local, and across the United States before it actually came to Cole County.
With one death and no active cases to date,
we still want people to take it seriously.
And with the state in phases of reopening, health departments across the area are prepared for a possible climb in cases.
Right now we haven't seen that increase, which we're very excited about, and we'd like to commend our public and our community members on still staying socially distanced from others, washing their hands, covering their coughs, staying home if they're sick, all of those things that you need to keep in mind and make a priority.
Both Callaway and Cole counties, along with surrounding counties, are functioning under the governor's reopening order in place. Boone County has an order of its own that took effect May 4th, which is more strict than the governor's. The county has 8 active cases and 1 death. However, Health Director Stephanie Browning's next phase of reopening gradually relaxes those restrictions starting May 26th.
We have to continue social distancing as much as possible. I think for a while that's going to be the new norm. We want to make sure that we can maintain our hospital capacity, avoiding any surges. So we'll continue to work with them like we do weekly, daily, really daily, but weekly phone calls. And we want to make sure we don't have any significant spikes in the number of cases.
Some changes include businesses opening at 50% occupancy with social distancing. Public gathering sizes can increase to 50, and by the end of August, that number could potentially be up to 250 people. At the end of each phase, the situation will be evaluated before moving forward with the next. Overall, health departments say everyone working together has brought the positive out of an uncertain situation.
For right now, we are seeing things leveling out and kind of staying in that spot, and I hope that we can continue that even going into the fall. But that's to be determined. This virus is totally different than anything that we've seen.
When Governor Parson announced the first phase of Missouri's reopening plan on April 27th, Prison Brews owner Debbie Brown had mixed emotions.
You know what, it felt good, but it was also one of those things that's like, you know, are we ready for this? I mean, we don't know.
It's uncharted territory. Back for their first time at Prison Brews in what seems like forever, customers are also unsure how to feel.
It's nice to get to this point that we can begin to recover, because until we started using terms like recover or normalcy, it was like a dark tunnel.
Throughout the stay-at-home orders, businesses have had to change their methods, from selling items in-store to selling online, from dine-in to takeout. Harpo's in Columbia, for example, has adjusted their business model.
Weekends are usually our bread and butter, along with a couple other nights throughout the week that we get pretty busy. But right now we're operating more as a traditional sit-down restaurant than a bar.
Changes can also come with complaints. Tricia Barnhart is an employee at this Walmart here in Fulton. She says customers are unhappy with some of the restrictions, like not being able to return items. But she also says restrictions and procedures have a purpose.
They really need to get educated and understand why we as companies and businesses put certain procedures in place to prevent it happening as bad as other states.
Businesses are welcoming back customers and navigating social distancing restrictions as the new normal. Prison Brews owner Debbie Brown says it's a good feeling to interact with the community again.
But you can just walk outside and you see people in their cars, and it was our regulars, and they're like, hey, everything okay, just coming to check on you. And so that was the neat part, is the community really getting out and supporting and helping us.